Okay.
Today we're going to discuss the ACL ligament crisis. It seems to be primarily in football, but it's frequently in basketball and baseball. And it's a ballistic injury. When you hear a pop, you know that ACL ligament is gone. Now, the standard treatment for that is rehabilitation or surgery. Now, the real problem with an ACL injury actually is that it begins in your foot with the pronation or supination, of your foot and your ankle. And then it also addresses your hip, because we're talking about a system. From your foot to your hip is a system. Now, what happens is, let's use football for example. These football players, they take hit after hit after hit, and they get micro changes in those ankle angles and the angle of the fibular head. And there's numerous muscles that go from your hip to your knee. So when you get enough hits and enough micro changes in those aforementioned areas, then it's only going to take that one final cut or hit that's going to then pop that ACL right off the bone, because it's a stabilization ligament, a main one, along with your medial collateral ligament. So if you biomechanically reset the hip and the ankle so that it's in the proper relationship with the knee, there's a 95% chance that you're never going to accrue those injuries. But to date, I don't see anybody really doing it that way. They wait till after the fact, and then they try to rehab it. And then generally what happens is you blew out the other one because you had the same biomechanical problem on the opposite side, or you blow the other ligament, the medial collateral ligament, out at a later date, because the mechanism that created the problem in the first place is still in existence. So if you want to correct the problem, do a system correction. Look at the femoral head angle relative to your knee. Look at your patellar angle, and then go down and look at your pronation, supination in your foot, as well as the subtalar joint. All those areas are involved in an ACL or an MCL injury. And if you keep those setting where they should be at 90-degree angles, then that athlete will be able to take that hit with not incurring that injury, which is really becoming an epidemic along with concussions in sports today. And remember, if you want to look, feel, and act years younger, get on my bandwagon. It's the way to go. It's Randy's Raiders. Be one.